Hello, and welcome to Evidence-Based Nutrition. We will begin this week with a brief overview of what is meant by research for the purpose of this course and in nutrition practice. Additionally, I will discuss evidence-based practice. Research is the neutral, planned, and systematic process of collecting, analyzing, and interpreting information and data to answer questions to advance knowledge. Research is unbiased. Research is not going to Google, Wikipedia, a blog site, or even reading a few studies to write a paper. Nutrition research is varied. We'll find studies that look at different cells in animals. There'll be intervention studies with small groups of human subjects. There'll be observation studies with many participants. And there'll also be case studies looking at one specific individual. Observational studies are typically used to create nutritional guidelines for broad groups of individuals and are typically conducted nationwide. There are many reasons for conducting nutritional research, including solving nutrition-related problems, working to improve client outcomes, providing cost-effective and efficient care to clients, and serving as a foundation for evidence-based practice. Evidence-based practice, or evidence-based medicine, is the integration of best research evidence with clinical expertise and patient values. Evidence-based practice in nutritional research means using evidence in practice to improve patient outcomes. It's important to understand that this is only one small piece of the evidence-based model. Research describing the best current evidence, along with clinical expertise and patient preferences and values, all should be considered in order to determine the best approach to care. Patient preferences and values can mean a lot of different things. For some individuals, this might mean not consuming animal products due to religious or other values. Other individuals may have a financial concern, meaning that they're not able to opt for the grass-fed, wild-caught, organic, pasture-raised animal products and produce that we would typically recommend. Integrating both the current best evidence, your clinical expertise, and patients' preferences and values will hopefully help us yield a better outcome for the patient. When determining the best care plan, it's essential to make sure that our opinions are non-biased. This means using our clinical expertise, but not creating a preset determination based on what has previously occurred with other clients or individuals we have worked with. This means looking at the evidence, considering our personal experience, and then also considering the patient preferences and values. Evidence-based practice starts with a question. It's not just any question, it's a very specific question. This question is formulated to help in the search of evidence to determine patient care. For example, I could ask the question, what is the difference between methylated folate, folic acid, and folinic acid? While this question might help me understand some valuable information, it's not helping me understand how I would best support patient care. Instead, I want to think about what factors might come into play that determine what form would be best for that specific individual. Step 2 is to locate the best evidence. This doesn't mean just looking at the first article that pops up in your PubMed search. We want to make sure that we're looking at high quality, original research, and ideally a meta-analysis. Step 3 is to critically appraise the evidence that we found. We want to make sure that we're remaining neutral and unbiased throughout this process. We want to look at when the study was conducted, who conducted the study, and if there are potentially any bias due to that information. Step 4 is applying the findings to make an informed clinical decision. This includes using both our professional expertise and past experience in decision making, while also sharing the information that we found with our patient so that we can work to make a joint decision. Step 5 is evaluating the effects and make adjustments as needed. This looks like recording and analyzing data in a systematic manner which may inform future practice or practice-based evidence. It's important to understand that these decisions, they're not a one and done process. We continue to adjust protocols as we continue to learn and as we continue to see how our patients respond.